everyone, welcome to my channel Learn Dentistry. Now this video is about the basic terminology which you all will be using frequently from the first day of your dental school until your lifelong clinical practice. So let's get started and get familiar with our mouth. First thing that you will be seeing in your mouth are the set of teeth, tongue, palate, uvula, tonsils and of course the lips. Now anything in the upper part of the mouth it is termed as maxillary and in the lower part it is termed as mandibular. So the teeth in the upper part of your mouth they are termed as maxillary teeth and in the lower part they are termed as the mandibular teeth. Next is our palate. Our palate or roof of our mouth is also divided into two parts. The front part of it is towards the teeth and it has an underlying bone and is termed as hard palate. And the back part of it is termed as the soft palate. Let's study the name of each tooth you will be treating. As I have told you, the one on the maxillary arch are termed as maxillary teeth and on the mandibular arch they are known as the mandibular teeth. So now the teeth in the front part of the maxillary arch they are termed as maxillary or mandibular anterior teeth and on the back of these arches they are termed as maxillary and mandibular posterior teeth. Now what are the names of each tooth that you see in maxillary and mandibular arch? Now there are two front teeth which are termed as central incisors. Next to central incisor is the lateral incisor, then is the canine, two premolars and the set of three big tooth termed as molars. Same is for the mandibular arch, central incisors, lateral incisors, canines, premolars and molars. Now next term that is frequently used by your dental professors and dentists also is the primary or dentition or the deciduous dentition and the permanent dentition. In primary dentition we have set of 20 teeth and in the permanent dentition we have the set of 32 teeth. Now in primary dentition we have central incisors, lateral incisors, canines and molars. So in primary dentition we don't have premolars. So in a child you will not see premolars. But in a permanent dentition there are set of 32 teeth, central incisors, lateral incisors, canine, premolars and molars. So that make a total of 32 teeth. The coming of these primary teeth in the mouth of a baby are known as eruption and the falling of these teeth they are known as exfoliation. Now there are different names for tooth surfaces also. The part of the tooth that is visible above the gums that is termed as crown. The part of the tooth below the gums that is termed as the root. The part of the tooth that is towards your lips or the face that is termed as the labial or the facial surface. Towards the cheek it is termed as the buccal surface. In the maxillary arch towards the palate it is termed as the palatal surface. The biting surface of the incisors and canines it is termed as incisal surface. The part of the tooth that is towards the midline that is termed as mesial surface. Away from the midline is termed as the distal surface. Biting surfaces of all the molars is termed as the occlusal surface. This word is from the occlusion, which means upper and lower teeth when coming together. So, the tooth surfaces are labial or facial, buccal, palatal, incisal, lingual, mesial, distal and occlusal. Next is the tooth decay. In dental terminology, decay on the surface of the tooth is also known as caries, which comes from the Latin word cariosus, which means full of decay. Now, there are different names for the gum diseases also. The first is your plaque. It is the collection of bacteria on the surface of the tooth which forms a biofilm called as plaque. Inflammation, in dental terminology, it is the swelling of the gums which can be caused because of various reasons, because of trauma, because of plaque also. Next is your gingivitis, which is the early form of gum disease in which the gums they get swollen and they bleed. Periodontitis, this is the severe form of gingivitis which involves bones and result in loosening of your teeth. That is termed as periodontitis. Other very common terms used by the dentist or your dental professors, they are dentulous mouth, edentulous mouth and partially edentulous mouth. Now, when there is presence of complete set of teeth in the mouth, they are termed as dentulous. When the teeth are absent in the mouth, they are termed as edentulous mouth, and when there are few teeth in the mouth of the patient, it is termed as partially edentulous mouth. Now, there are various specialities of dentistry. These are endodontist, oral medicine doctor, oral surgeon, orthodontist, periodontist, periodontist and prosthodontist. Now, what does endodontist do? They are the doctors or the specialized doctors which deal with the problems of tooth nerves and pulp, and they are specialized in doing procedures to treat the same by root canal treatment, also called as RCT. Next is your oral medicine doctor. They diagnose and manage patients with disorders of face and mouth and advise biopsies, medical management and specialized pain injections. They are also specialized in reading or advising oral x-rays. Next are your oral surgeons. They perform your tooth extractions, trauma surgeries, corrective jaw surgeries, and they are also specialized in placement of implants. Next are your orthodontist. They correct the position of your teeth which with the help of braces and other modern dental methods. Next is your periodontist. These are specialized in treating children and the patients with mental health care needs. They are experts in treatment of deciduous teeth or primary dentition. Next is your periodontist, specialized in treating periodontal tissues that surrounds the teeth, including gums and periodontal tissues. Next are your prosthodontist. These are the doctors which are specialized in replacing missing teeth with crown, bridges, dentures and implants. These artificial replacements are known as prostheses, hence the name prosthodontist. The list of new terms will be added in each year of your dental school. Hope these terms would be useful for all the beginners to start the new career in dentistry. Thanks for watching.